The cholera epidemic is spreading. These are new cases. They're being screened before treatment. This outbreak isn't over. If anything, it's getting worse. With a concealed camera, we got inside one of the most guarded buildings in Zimbabwe, the Infectious Diseases Hospital in the capital. On the pretense of looking for the relative of an employee, we convinced a senior health official to help us. He works for President Mugabe's government. His opinion on what's happening here is illuminating.
You have people who are already starving, and when they get dehydrated, it's almost impossible to rehydrate them. And you have those that are already infected with the HIV. They are susceptible naturally to these conditions. Most of them don't survive. The very strong ones are the ones that make it. It's an inmate because
why?
They sat in their parliament and decided to remove the running and the distribution of water from local authorities, and they put that function into the central government.
Why did they do that though?
For selfish reasons. It was a vindictive move to try and frustrate the efforts of the opposition council, because they'd won in all urban areas.
The poorest are suffering for certain. The rainy season has started. Each downpour spreads more filth along the streets. Broken sewers pump dirty water through the townships of the country's poorest areas. Drinking water is contaminated and the infection spreads. Families are powerless to stop the death of their loved ones. Most are too scared to talk openly. This lady's baby nephew died a day after he was admitted to hospital.
Did the police come and take the bodies?
The police, they take them to the mortuary, and then they take them to the relatives who then be took to the graveyard.
And were a lot of people dying in the hospital?
Yes, lots and lots of people dying at the hospitals.
Any idea what sort of numbers that day that your niece died?
That day there were 20 people who died.
Whatever President Mugabe says, there are more and more cases of cholera. It's spreading from shanty towns like this one on the outskirts of Harare into the countryside. Every day we're being told of more and more cases, particularly away from the capital. The aid agencies are confirming it, the government's denying it. The aid agencies are struggling to fight a disease that was made worse by the state's refusal to acknowledge it, and because it is so dysfunctional and it can't cope. This hospital to the north of Harare is modern and large.
Myself, about 20 people.
It should be at the centre of cholera treatment in the area. Instead, it's deserted. I walk through corridor after empty corridor. There's no mains power. The generators are hopelessly inadequate. Most of the staff are on strike. Not about pay, about no pay.
Yeah, well, it's a state of emergency on the border now.
Piles of soiled bed linen and clothes go unwashed. The stench is terrible. Zimbabwe is falling apart at nearly every level. The exception, of course, at the very top. In wards and tented clinics shielded from the outside world, President Mugabe's people are dying from a disease that is easy to treat if the social safety net is working. Zimbabwe's safety net collapsed years ago. Stuart Ramsey, Sky News, Harare.